Just a couple more minutes, folks. Good afternoon, everyone. My name is Brody Fernandez. I'm the Communications Director for Assemblywoman Esmeralda Soria. Thank you all for being here today. A little bit of the run of show real quick. We are going to have our electeds and our guest speakers, CEO Steve Stark, say a few words. After that, we will be having a 10-15 minute presentation. We have several joint resolutions to present, along with a letter from the governor. After that, the ribbon cutting will take place, and we will all enjoy our evening. So without further ado, I'd like to introduce Madera Community Hospital CEO Steve Stark.
Good afternoon, everyone. It is truly a privilege to be here and stand with you today as we celebrate not just the reopening of a hospital, but the rebirth of a cornerstone of our community, Madera Community Hospital. After more than 26 months of closure, today marks a triumphant return, a moment we longed for, we fought for, and now finally we get to see become a reality. This is more than a ribbon cutting. This is the symbolic reopening of the front door to health care for the people of Madera. And behind this door is a renewed commitment to care, to serve, to heal, and to protect the lives of every individual in this region. That's why our motto, Hope Restored, isn't just a slogan. It's a declaration of who we are and what we're here to do. When the hospital closed in early 2023, the impact on the community was immediate and devastating. Sorry, I don't want the wind to blow this to Fresno. People were left without access to emergency care, without labor and delivery services, and without a place to turn when their health and lives were on the line. But what followed was a story of resilience. A coalition of voices rose up, from local leaders to state and federal champions, all saying the same thing. Madera deserves a hospital. Madera deserves access to care. Madera matters. I want to express our deepest gratitude to every stakeholder who helped make this possible. Our city, county leaders, and state leaders, our federal partners, our dedicated hospital staff, and especially those of you who stood by this hospital even when its future was uncertain. You are the heartbeat behind this revival. And at the center of this journey stood our Madera Community Board of Trustees. This group didn't just simply volunteer their time, they carried the weight of this entire community's future on their shoulders. Through moments of doubt and immense pressure, they stayed the course. They made difficult decisions with wisdom and courage, and they never stopped believing that this hospital could and should come back to Madera. To the board, thank you for your leadership, your dedication, and your unwavering resolve. There are also two public servants whose names must be spoken with special recognition today. Leaders who did not stop until this hospital had a pathway forward. Assemblywoman Esmeralda Soria and Senator Ana Caballero. Your leadership in Sacramento was not only tireless, it was transformative. Thank you to your efforts in passing the Distress Hospital Loan Program. Madera Community Hospital had the financial foundation it needed to reopen, but only by your efforts alone. Without that legislation, this day simply would not have come. You didn't just save a hospital, you restored healthcare access to more than 160,000 people in this region. On behalf of all of us, thank you. But today is not just about reopening. It's about reimagining what a hospital can be. This new chapter is not a return of what once was. It is a leap forward. We are growing, expanding, and investing in services that meet the evolving needs of our community. We're proud to announce the addition of new specialty services, bringing physicians and clinical care options to Madera that have never been available here before. No longer will our residents need to travel to Fresno or beyond for the care they deserve. Specialty care, including orthopedics, cardiology, nephrology, and women's health, are now coming to Madera. And with each of these services comes state-of-the-art technology. For the first time in our history, we now have a brand new MRI on site, fully integrated with our emergency department. This means faster, life-saving imaging is now just steps away for our patients, especially in trauma, stroke, and critical care cases. This is something Madera has never had before, and now it's here. And in just a few short months, we will be launching 3D mammography services, the most advanced breast imaging technology available today. This new service will go live in about 90 days, and it'll allow for earlier detection and better outcomes for the men and women in our region. It is another powerful step forward in our commitment to proactive preventative care. When we say hope restored, we're not just talking about beds and machines. We're talking about confidence, dignity, and access to care that saves lives. We also know that the health of a community cannot be carried by one institution alone. That's why we're continuing to grow and strengthen our partnerships with city and county leaders, emergency services, behavioral health teams, and public health departments. Together, we're building a seamless network of care that meets the people where they are and connects them with the support they need. And most importantly, it's about the people. It's about the grandfather having chest pain and now that has an emergency department just minutes away instead of miles down the freeway. It's about the child with fever, the teen with a broken arm, the senior who needs a safe place to recover. They now have a hospital that's here for them again. To our staff, both returning and new, thank you for believing in our mission. Thank you for showing up with heart, with skill, and with purpose. You're the reason this hospital isn't just a building, it's a place of healing. To every elected official, community partner, and citizen who lent your voice, your effort, and your belief, we owe you our deepest thanks. And to the people of Madera, this hospital belongs to you. It exists for you, it stands because of you, and it will continue to thrive with you. Let today mark the beginning of a future where Madera Community Hospital isn't just open, where it thrives. Thank you for being here to witness this historic moment with us. We will soon cut this ribbon. We've opened our doors, and we'll walk together in health, in hope, in unity. Hope has been restored, and we're just getting started. Thank you. And I'd like to turn it over to Senator Ana Caballero.
Well, good afternoon, everyone. Uh-oh. Had too much lunch. Good afternoon, everyone. It's more like it. Thank you so much for joining us here today, and thank you, Steve Stark, for that, for the accolades. But we didn't just do it ourselves. It was a community effort. It's an honor to be here with you today to celebrate and renew the commitment to the residents of Madera County. And as you know, when Madera Hospital closed 2+ years ago, Madera County residents lost a vital lifeline and important access to health care. Families lost precious time traveling out of town for emergency medical services. Many times what happened is that they lost faith in the system, that it would be there for them when it mattered most. But Madera residents did what strong communities do. They stood up, they spoke out, and they basically said, we deserve better. And you were right. So we all got to work, and I'm really pleased and proud to be here with my good friend and colleague, Senator Esmeralda Soria, who has been with me 100% during this entire journey. But we also had the Board of Supervisors and members of the City Council, as well as the mayor, that were working with us. Everybody had the same mission, the same goal. We met with the Governor's Office, with the Attorney General, with healthcare experts, and the Department of Healthcare Access, and many, many local leaders, some who are in this room and some who couldn't be here today. And as I said, we partnered because the kind of fight that we were engaged in takes teamwork. Together we created something new, which was the Distressed Hospital Loan Program, designed specifically to protect communities like Madera where care was at risk. And when I spoke with the Hospital Association when this hospital filed for bankruptcy, I was told that 6 or 7 other hospitals in the state of California were likely to close that same year or file for bankruptcy, and that 6 or 7 the following year. So we understood very, very clearly that although we were working on behalf of Madera, we also needed to do something bigger than one hospital, and that was the genesis for the Distressed Hospital Program. So we passed that important legislation, and we secured the funds to deliver the largest award in the state out of the Distressed Hospital Loan Program of $57 million. Okay, thank you. This wasn't just about reopening a facility, it was about rebuilding trust. And so what does that mean for Madera families? It means that when your child has a fever at midnight, same example, you need to know what to do and whether it's serious. And you don't have to wait an hour to be seen at another hospital. It means our elders, our farm workers, and our working families can access care in their very own community. It means that your voices mattered and your fight changed policy at the state level. This hospital is back because Madera refused to give up and refused to walk away. So we listened, we planned, and we delivered. But the job isn't over yet. Trust takes time, and Madera Hospital is a private hospital, and so we are going to need for them to check in with us periodically to let us know what's going on so that we can continue to be helpful, so that we can continue to be supportive. And quite frankly, we have to vote, or we have to engage with our health insurance policies. It's important that if you have private hospital coverage or private, what is it called, private contract insurance, that this be your hospital of choice. Because when you don't make it your hospital of choice, then the ability of the hospital to negotiate for a good reimbursement rate is very, very hard. And so we all need to make the commitment that Madera Hospital is important to us, and that we want it to succeed, and that we're gonna utilize the services that are here. So building up trust is important. And if we all support the hospital, utilize its excellent services, and you heard about the expansion of the services, which are going to be phenomenal, and you support the clinics, we can ensure that the hospital prospers and continues to provide needed services. Let today's ribbon cutting be a reminder that when communities unify and speak in one voice and government shows up, we can do big things. Congratulations to the hospital, congratulations to the county, and congratulations to the city of Madera. And I thank you. So I want to add something. That, there was a member of the public, a member of Madera Community that was going to speak, Spanish-speaking speaker, and she's a terrific organizer in Madera and a real committed person who really believes in the hospital and wanted to be here. But quite frankly, in our conversations, I was concerned about the fact that we can't guarantee that people of mixed immigration status can travel in our communities and be safe and not have to worry. And I'm sorry if some of you see that as a political statement, but I advised her not to come, and I told her I would very briefly read what she was going to come to say today, because she loves Madera and she loves this hospital and she wants it to be a success. So this is what she has to say. It is an honor to be able to thank the work of champion leaders such as Senator Ana Caballero and Assemblymember Esmeralda Soria, who have fought for our community. And I just have to tell you, I never use the phone, so please excuse me if I close the window unexpectedly. She said, my name is Mary, and I represent people who have a need for primary medical care, to be able to supply medicines, to come to the community hospital, and to have a reference to the specialists. It is very important for us that access to medical care is a priority among our families. When closing the hospital, we suffered for not following up on treatments, seeing pregnant mothers pause their medical appointments, and waiting for that referral for surgery. That is why today, on behalf of the community of Madera, I extend my gratitude and encouragement to the doctors, the nurses, the administrative staff, to continue joining forces so that the hospital is a safe place for patients and that medical care is of quality. Thank you again very much to our elected leaders for loving Madera so much and for supporting each of its members. God bless you. From Mary. And so it gives me great pleasure on behalf of the California State Senate to present this resolution in recognition of this groundbreaking. Congratulations, and to the community of Madera, congratulations on a great feat. And now it gives me great pleasure to, we always joke about we're partners in crime, but it's probably not the appropriate place to say that. Let me just say that one of the greatest things is anytime you're working on something, you need somebody in the assembly when you're a senator that can help you move your legislation or your financing issue, whatever it is, through their house, because we have two houses. And it's been great to have Assemblymember Esmeralda Soria over in the Assembly really doing the hard work on behalf of the whole district. And so it gives me great pleasure to recognize Assemblymember Esmeralda Soria.
Good afternoon, Madera. It's a day to celebrate. Thank you, Senator One, for being a great example of leadership in our community and in the state of California, and for your years of service to this valley. So I wanted to thank you. Thank you, Steve. Thank you to Madera Community Hospital for having this event to be able to celebrate. I know that just a couple months ago, we did an earlier ribbon cutting celebrating, again, the reopening, and really celebrating the patience of the community, the hard work of not just elected officials at the state level, but folks and partners here at the local level that worked hand in hand with all of us to make sure that today is a reality. As you guys heard, and many of you guys know already the story, obviously the doors were opened back in March 18 of this year. And that really marked the new beginning for Madera and our surrounding rural communities. What I believe is that we sent a message that day, and we're sending a message today that to all the struggling rural hospitals throughout the state of California. And that message is, don't give up. You're not alone. Reach out to your elected representatives. And most importantly, get to work, because right here, what you guys see right behind us and behind me, when you walk through those through those doors, through the newly renovated building, you can also see in your community. It won't be easy, I will say, because I will say that this process has been a difficult one. But then, nevertheless, every single phone call, every single email, every single meeting, and they have been countless. I can't even count how many meetings we've had on this hospital, have meant everything to me, because at the end of the day, it has been for the residents of Madera County, for those that live not just in Madera, but actually live outside Madera County, that also relied heavily on the critical services that this hospital provided for almost 50 years. And so before I move on to share a few other remarks, I do want to just recognize other leaders that we have been in touch with since the beginning to make sure that today was a reality. I want to recognize the work and the commitment of Madera County Board of Supervisors, who they also have contributed to the success and the reopening of the hospital. I want to recognize leaders that are here, like Mayor Cici Gallegos, who is here, Councilwoman Anita Evans, Council Member Artemio Villegas. I believe I saw Council Member Jose Rodriguez. Also, we have our Madera County Superintendent, Cecilia Massetti, in the back. And if I missed, hopefully I didn't miss other leaders, but if I do, I'm so sorry. I just kind of looked around and wanted to recognize all of you. But I also want to thank the leadership of AAMI for stepping up to the table. I know that it wasn't an easy decision, and that it's been a lot of work. And so I feel honored to represent this community. And like I told the residents that I've represented now for over 2 years, this has been my number one priority when I stepped foot in the legislature. Because as you guys heard, the doors closed, I still remember, December 22nd, just 3 days before Christmas. And so it was a devastating occasion for our community to lose a critical hospital, a hospital that for 5 decades provided the critical care that many of the residents that live in this community have had access to. And in particular, some of the most vulnerable communities, those folks that are farm workers, immigrants, many of them, the stories that we heard, that were able to walk to the hospital when they had an emergency, no longer had a lifeline over 2 years ago. And that's why when I stepped foot on the state capitol, I made this my number one priority. And I will say everyone in Sacramento knew I was the Madera Hospital lady, knocking on doors, taking no for an answer, being persistent, and then working really hard with Senator Ana Caballero to make sure that we got the Distress Hospital Loan Program. And I will say I'm very proud that very quickly in that first year that I was in office, within the first 150 days, we created the Distress Hospital Loan Program. As the Senator mentioned, yeah, very quickly. And as the Senator mentioned, it provided a lifeline not only for this community, but hospitals down the road, like Cahuilla Delta, where I was born in Tulare County, received over $20 million to keep its doors open. And that's what this has been about. It has been about making sure that rural communities also have the access to health care that they deserve. That no matter what zip code you live in, no matter where you come from, no matter what language you speak, you have the ability to go to access the critical health care that you and your family deserve. And so I want to thank every single person that has been involved in the last 2+ years in the process. I want to thank Governor Newsom as well, and I will read a little letter that he sent on his behalf, because I will say Governor Newsom's staff was with us on so many calls, and his staff and administration at HCI has continued to be on so many calls with us to make sure that today it was a reality, and also that we continue to ensure the future of this hospital. And so today I want to congratulate everyone that was part of this reopening, but I also want to just remind folks that while today we celebrate, that we must remember that we must continue to work hard. As you guys have heard, Medicaid is on the chopping block, and we know that this hospital relies heavily on those reimbursements because the population that it serves is predominantly covered by Medi-Cal here in the state of California. So what I want to ask of you, of each of you, as we celebrate today, all of us here under this tent, all of the folks that work in this building and our community folks, when they see, the news that their hospital is open, that we remind our federal leaders that we need to protect the investments on Medicaid. We need to make sure that those dollars come to this community and they reach this hospital, because I don't want to be faced, 6 months down the line with the news that this hospital will close, and at least not on my watch. And that's one of the commitments that I will continue to make to the residents of Assembly District 27, that as long as I am your elected official, I will fight hard to make sure that this hospital has the resources it needs and the resources it deserves to provide the quality of care that Maderans deserve to have each and every day. So we have work, okay? But today we will celebrate that hard work, and we will continue to work together to ensure that those critical services, because you all know I've been a big advocate of labor and delivery. We want our moms that live here in this community to be able to birth their kids here in this community rather than having to drive all the way to Fresno or all the way to Merced. They deserve to be able to deliver their babies here in this community. And so I will continue also to work to make sure that those resources come to back to this hospital so that we can celebrate bringing back those services when the time is right. But in the meantime, again, congratulations to everyone on all the hard work. Look forward to continuing to work with you guys to ensure the success of Madera Community Hospital. So just in closing, I do want to read on behalf of the Office of the Governor a letter that he does send for the reopening of Madera Community Hospital. So on behalf of the state of California, I am pleased to welcome all who have gathered to celebrate the reopening of Madera Community Hospital. When Madera Community Hospital closed more than 2 years ago, the impact to the community was immediate and profound. Hospital employees lost their livelihoods, patients lost access to life-saving care, and residents experienced deep uncertainty about where they would go in an event of a medical emergency. It quickly became clear that Madera residents needed access to medical care in their own community. Thanks to the leadership of Senator Ana Caballero and Assemblymember Esmeralda Soria, that vision is now a reality. The creation of the Distress Hospital Load Program allowed the state to provide $57 million in critical funding to support the reopening of Madera Community Hospital. Today marks an important step in our journey to ensure that all Californians have the health care they need and they deserve. As I join you in spirit on this occasion, I am wishing Madera Community Hospital a bright and enduring future. Sincerely, Gavin Newsom, Governor of California. Again, I forgot to mention and want to recognize, I know that we do have a representative from Congressman Adam Gray's office, India, who's in the back. Thank you for also being here. Next, I did want to call up Miss Carolyn from the California Health Facilities Authority. I think she's here. Is she here? Oh, there we go. She has a special presentation.
Thank you so much. This is a certificate from the California State Treasurer, Fiona Ma, and the California Health Facilities Financing Authority. I'm the executive director. We worked very closely with the Department of Healthcare Access and Information and Assembly member and senators' offices in developing the language for the program, and appreciate all their support, the work of the hospital, and want to present the certificate to the hospital. We really appreciate the work you've done, and we know we have a lot of work going forward. So thank you.
Good afternoon, everyone. I'm Cece Gallegos, the Mayor of the City of Madera. I would like to call my colleagues up to the stand with me because this is a presentation that's not only from me, it's for our entire council. So if those members could come up while I do this little short speech I have here. I'm going to delete some of it because we've heard all these wonderful things from our electeds that are to the right of me. I have to tell you, born and raised here, I love Madera. I'm not going anywhere. I had my children here. The hospital became my second home. My parents were very ill, and we were here all the time. Everybody's like, well, aren't you afraid? You know, they're at the hospital, you know, all the machines and everything they're doing. I'm like, no, it's become our second home. And so when it closed, it was really a sadness to a lot of families in this community because it was their second home. It cared for all of our children and our parents and our grandparents and our uncles and our aunts and our friends. So when it shut down, it was very devastating. Some of you here I notice in the audience, I see familiar faces, I see some new faces, and you have to know that the city represents this hospital 110%. We have our city clerk here, we have our commander, our lieutenants, our sergeant, and I could keep going on. Our Madera Tribune, Wendy, who's always saying wonderful things and spreading the word to our community to let them know what's happening here at the hospital. But I have to tell you, it wasn't something that could happen without all of you and all our community members, and especially Assemblywoman Soria and Senator Ana Caballero. There is no way this could have happened without their support. I have to tell you, too, that, thank you. A few months ago, this community rallied, and we thought we would probably get maybe 50 people in the hospital to pray, to have it open. We were so shocked. There was probably 300 plus people here praying in January for this opening. And I really feel that the power of prayer goes a long way. And we will keep praying for this hospital to be successful and keep it uplifted in positive thoughts to make sure that it still takes the place of care and health care for this community. I thank Steve Stark and his staff. There is no way we could do it. I see a lot of them around to the left and the right of me, and all the doctors that invest their time in this community and care to make sure that they're healthy and they're able to do their jobs and take care of their children. So on behalf of my colleagues and I, here's to a healthier and stronger future in the city of Madera. And if you have a water bottle, raise it up and cheers to the opening of Madera Community Hospital. Thank you very much. Come on up, Mr. Starks.
We'll come down. We'll come down. Oh, you have them. Okay. Who's cutting? Is that me? All right. Let's cut this thing.
I think we got it.
If you would, please grab some food. We've got food at about every corner, so please do that. And please visit our vendors. They've came out to join us tonight, so please join them, say hello, and enjoy the evening. Thank you all. Oh, and somebody lost their cell phone, so it's got a beautiful little puppy on it, so if this is yours, we'll put it up here on the stage.